Hi, this is Dr. Toby Moma, your host on Health and Wellness with Dr. Toby, inviting you to watch our show this week. We have a special guest, Miss Felicia Downs. She's a local of the area, trained, raised in Bastrop. She's going to share her heart with us about the community. She's a licensed community social worker, went to ULM and went on to Southern University in New Orleans, and she's going to be pouring out her heart about her pet project. She just opened an agency called Resilience, and is designed to mitigate the after effects of perinatal morbidity mortality on our young children under 1 year of age. You don't want to miss it. She's going to pour out her heart about family, about the church, about spirituality, and how being a social worker has inspired her to make a difference. This is a lady who's lived a life as a daughter, as a sister, and as a minister in the church, and she wants to be a blessing to you through this medium. So don't miss it. Check it out. God bless you. Jesus is Lord. Your host on Health and Wellness. It's a pleasure to have you on our show today. Don't touch that dial. We have a great show in store for you. Our guest today is Miss Felicia Downs. She's a licensed clinical social worker trained in NLU when it was called NLU. Now she did her bachelor's at NLU, went on to do her master's in Southern University in New Orleans, has been practicing 23 years in the community, worked in Lake Charles, predominantly worked in Monroe, Louisiana, and she's come home with a vision and a mission. She wants to be a blessing. She wants to help stem the epidemic of perinatal infant morbidity and mortality. And she's opened a group, an agency called Resilience to address that. And we're going to put the address on the screen. Those of you who want to contact her. Thank you for coming on the show, Miss Felicia. A real pleasure. Real honor having her on the show. As a medical person, I know the value of my social workers, and we don't take them lightly. They help us get out of very naughty situations. Tell me, what role do social workers play in this current opioid epidemic? What's their capacity to come in and help? Apart from, as doctors, we give all the prescriptions, but what role can a social worker play in this whole epidemic that is ravaging the United States right now?
I think a social worker can play the role of also providing counseling and therapy to sort of mitigate that pain that they're receiving the prescription for, as well as also education. We're doing a lot of education on the harmful effects and the ability to the controlled substances to be very addictive. And so we're helping patients to monitor their usage and also having that communication back with the doctor. We're able to see the client a little bit more often than the doctor does. And so therefore we're having the client to come in and communicate with us. And through counseling, we're sort of getting an understanding of how often they're taking their medications. And when we see there's a misuse, then we are actually providing more therapeutic services for that individual. And then also educating the doctor on what we're seeing.
Right. What's the state of the opioid epidemic in Louisiana? I know Ohio is top of the chart, and there are a few other states, but I don't know where Louisiana stands in the whole
The
crisis.
last conversation I had, we were pretty much close to 2 or 3 times the number of prescriptions written for opioids for every citizen in Louisiana. Meaning, for every citizen, there's 3 prescriptions written on your behalf. Now, you may not be receiving those prescriptions, but that's the number, that's the volume of prescriptions that are being written.
Wow. And in the Northeast Louisiana, what resources do we have? If you have a family member who maybe needs to have addiction counseling, get help on dependence. When we say dependence, we include alcohol, we include
Right.
opioids, we include marijuana, cocaine, crack, heroin, what we call substances of abuse. Okay, the list goes on.
Yes.
Meth. So if somebody is in that nutshell, that group, where can they get help in our community?
If they are on an opioid and we advise them to get medication assisted treatment, and they can do that with the Center for Behavior Health on Monroe on Minnie Ruffin Drive. That is the place that accepts private pay, and they also have a program that the state has kicked in. And if you don't have the ability to pay, the state is paying for those services. But they provide some outpatient treatment as well. We have a number of outpatient addiction facilities throughout the region who you can access, even if you have Medicaid. Medicaid pays for behavioral health services, it pays for mental health treatment and addiction treatment. We have inpatient facilities that Medicaid also pays for, along with commercial insurance as well. So if you're in need of assistance, then you can contact your insurance plan, and they can sort of tell you where is the local agency closest to you.
And this is what I've heard a lot from, I go to the prisons to minister, and there's a high recidivism rate. 60% of prisoners will return to the prison within 3 years.
Yes.
And a lot of the time they say the reason why those prisoners return is they were opioid dependent, they had drug substance abuse issues, they didn't get it addressed while in prison, they come out of prison, they are homeless, they get back in the same group that led them into trouble. They get back on drugs. They get back in trouble. They get back in prison.
Right.
I don't know if your research has shown how we can break that cycle. Not talking of, I know in prison, I know they get limited help, but what can we do when they leave prison to stop them from being homeless, drug addicts, hanging out with the wrong crowd, and just being not having any social amenities. I mean, they come out, they don't have insurance, they don't have access to medications, so they're literally on a hamstring budget,
Right.
you know.
Right.
So how can we help those particular, and the reason I'm bringing this up is because I hear 50% of African American males have had a time in prison or the other. I've heard that. So I don't know how true it is, but if we have such a large number of African American males going through the prison system, I know 12 million Americans go through the prison system every year, then how can we stop that prison system becoming a vicious cycle that just degenerates into a life of crime and a life of drugs, So have you ever thought about doing something for those who come out of the prison system?
Yes. I think one that we first have to understand, abstinence and recovery is two different things. A person may not have access to the drugs in prison, but that doesn't mean they're in recovery, or that they have that they are okay when they're released, because we always talk about changing people, places, and things. Well, they're discharged or they're released, and they're going back to the same environment where they came from, and because they have to have an address when they're released. And so I think if we did more work while they're still in prison, and we are preparing them to be released, and let's talk about those, let it be a smoother transition, that it's more of a hands-on approach, that we're able to connect you with a counselor who's actually be part of your release, a conversation that you're actually having before you return to your local community. Let's link you up with treatment. Let's link you up with some peer support persons or some recovery advocates in your local area to make sure that you're getting the help that you need, and that we can plug you into those other services, that you're first helping you find a job. Where's those places that help with reentry back into the community? I think we can do a better job with reentry as far as education and making sure that individual is taken care of and that they are connected to where they need to be.
A lot of young people leave let me use an example. There was the Desert Street shelter recently went through a change of, I think they were trying to change the ownership structure. Salvation Army, I heard they closed. Am I correct?
They closed and they reopened.
They reopened now. So if I came into Monroe, what services are available for somebody who's indigent and homeless and needs access? I mean, how can I access those those resources. I mean, how do I know what is available in the Northeast Louisiana area? I
Uh,
mean, we can do it over the television right now, but
right,
there must be a website or somewhere I can find resources for indigent, homeless, hungry
right,
individuals to help them. Like I'm thinking of just people who come out of prison, they can't
right.
get, they don't have anywhere to stay, you know. So what can this kind of people do?
They can contact 211. 211 is our sort of resource that collects all of our agencies' resource information.
It's a phone number.
It's a phone number, toll free phone number.
211.
211
Awesome.
is manned by the United Way, and they make sure that all of their local resources they have the information, the eligibility criteria, and how to connect with those persons.
Okay. Any ideas what we have available? You just said, because I thought the Salvation Army was closed, so they've reopened.
Yes, they have reopened.
Okay. And they are open daily, but you have to reapply at 4 p.m. from what I heard, right?
Right. So,
Okay.
yes, so the Salvation Army is available and they have limited capacities for the number of persons that they can serve. And so you do leave during pretty much the majority part of the day and then you come back that afternoon to see if it's a bed available for you.
What made them leave, if I may ask, because I didn't know the whole picture.
They encourage family people. They want to identify other resources, maybe job opportunities.
Okay.
Some are actually leaving. They're in between jobs and
Wow.
housing, instability housing. So they able to go to find work, and then
Okay.
they are able to
Why did
return.
they close last 2 years ago? What was the
I think
reason? Financial.
finances.
Okay.
There's not a lot of funding in housing. I know the Wellspring has a program that they are trying to do some rapid rehousing, where the person who may lose their housing, they're trying to get them back on their feet pretty quickly.
How about Desert Street Shelter? What's the current state of that?
I think that the Rosier Street Shelter is still in need of donations and support. They're a nonprofit organization, so they don't receive any governmental contracts. They don't have, so they rely heavily on just grants and financial
So they were
contributions
about
from.
to close a few
Right.
years ago.
hmm
But it's not a 24-hour shelter, is it?
I'm not sure what they
Okay.
currently are. I
Okay.
know they provide great services for men and women, and so I think if we can work, if agencies can work with them actually
Hmm.
and do more maybe on-site services for them, then maybe we can help. There are individuals who are there to stabilize and get them, and then make room for other people to be served.
How about soup kitchens and food banks in the area?
We have Northeast Louisiana Food Bank on Central Avenue, and then we have some soup kitchens that are downtown. We have Grace Plates. We have some soup kitchens on Jackson Street, so individuals can come and get a hot meal.
Okay. And that's not daily, or is it like
Pretty
twice a
much
week? Oh, almost every day.
almost every day.
Okay. Okay. And I know some churches, do some churches have soup kitchens as well?
Right. Some churches in their own their ministries that they do, they have they may feed. I know several churches feed. They will actually go to underneath the bridge, underneath the Desire
Wow.
Bridge on a weekly basis. They have different churches that go and feed the homeless population that's there.
Wow, interesting. Just want to bring up this issue. It's been a controversial topic. Some people say handouts don't work. It's better to give a hand up.
hmm
As a social worker, I don't know what side of the debate you're on. The argument is that don't give a man a piece of fish, teach him to fish.
Right.
Don't give a man a handout, give him a hand up so he can provide for himself in the future. What is your perspective of that, especially in our local Northeast Louisiana environment?
I believe in hands up. I believe in teaching the person to fish. I also believe in giving that person services and support. Really, I'm about support and help making sure they're stable before. Sometimes I've heard people talk about the amount of services that we offer, but making sure that those services are available and what the stipulations of those services are to be able, for instance, families. with certain housing programs that are available. A lot of families, we see a lot of single mothers in those housing programs. But that same family who may have the dad in the picture and the mom, we don't have programs geared toward them because they may be a little bit over the threshold. I'm really attentive to the working poor, those who are right above that threshold that um, they don't meet the requirements for government assistance because they make just a little bit too much money. But I think if we had more programs that we are able to assist them as well, because sometimes they need, with the rising cost of living, we have gasoline costs that is high. When it becomes winter, we have natural gas costs that is expensive. Housing, finding affordable, decent housing is an expense. But sometimes people just need a hand up.
So a combination of both to
Hmm.
leverage the person till they can get up to speed
Yes.
on their career and all that. Wow, that's a good answer. So talk to me about your background. When you started, was there any mentors in the area of social work? Was there any people who instigated you going into social work? I mean, I'm bringing this up because you
Hmm.
said you were raised in a single parent home. Your mother was not a university graduate. You went into social work with the desire to help other people. But around you, were there people who you could say she was a role model, she was a mentor? And I'm bringing this up because some people think it could be the family demographic or family situation that inspires you to become better. So, for example, somebody who was sick as a child, they want to be a doctor to help treat people who had the same condition.
Hmm.
Did you
Hmm.
think in that regard when you went into social work, I want to make sure families don't grow up divided. I want to make sure families stay together.
Hmm.
Was that ever a motivation for you going into social work?
I think my motivation was that I just wanted to help families in general. Not
Mm,
that I met a lot of social workers prior to me going to college, but while I was there, Dr. Jenny Savage, she was doing a vast number of things, and I was just kept thinking, I want to be like her, do multiple things, and just be involved in all aspects of how to, provide quality services for the families that we serve. And I think for me, I wanted to sort of displace that myth that because you come from a single family household, then you can't achieve certain things. I remember going through college, and I think it was my senior year, and it was in one of my family sciences classes, and we had to write a paper about ourselves. And I talked about being from a single parent household and that my parents were divorced. And all of my peers were like, "When did that happen? When did that happen? We didn't know." And I was like, they was like, "Well, you don't act as though you came from a single parent." And I'm thinking, well, how should I act? What does that mean? How should I act as though my mom raised us? And so, or that I have siblings and we all have the same father. So, what does that mean? So, I think some of the myths and stereotypes that are placed on people limits them to becoming and knowing that they can achieve no matter where you're from, what your socioeconomic status, what your race is, that you can be, you're only limited by your own
my
dreams.
own dreams. Wow. Now, you attend the Assembly West Monroe. Tell us a bit about your faith walk, your life journey. I mean, coming to faith. You said in your early 20s, and you've been able to. Has there ever been a point where your faith conflicted with your career? Did you ever have a time when you couldn't do something because you felt your faith was opposed to that social work decision?
I don't think it's ever really been a time that there was a conflict. I think some that it was a true conflict. I think it was a time about 10 years ago where I was not that it was against my faith, but it was outside of the will of God for my life at that time. That I was out of place, if that makes sense. That I feel like now that I'm more attentive to doing things in the right timing. That even though God has given me a purpose and a plan, that it's according to His timing. And sometimes we can be too early or get involved in things that is not His will, and it doesn't necessarily go against what we believe. It's just not the right thing for us. And I think at this place in my life, I have seen God open up so many doors, and I've been in contact with so many people that ordinarily I should not even be having conversations with these people. And so, and I know that that's me now really focusing and saying, okay, God, you take the lead on this. You show me where I should be involved in, who I should contact. And then it's not that I'm necessarily reaching out to people, that they are reaching out to me.
What do you say to that young girl who wants to do social work, but she feels it's depressing, it's heartbreaking, it's life on the edge. You're literally sitting on the edge of your seat because you don't know what calamity is gonna come across your desk. So she's literally not wanting to do social work because she doesn't think it's emotionally comfortable for her. What do you say to that person?
I say pursue it. I say that we have so many rewards that come with this field of work that you are able to look back on generations that you've helped and made a difference in their life, and they come back and tell the stories of that you made a difference. If you want to really be a change agent and leave a lasting impression, go for it. We, as the social work organization in itself, is very supportive. We defend each other. I have a lot of people who are different friends of different disciplines, and they were like, oh, those social workers, because we believe in sticking together. We believe in not just, we believe in our organization. We believe in our field of practice, and we take pride in the work that we do, and we're excited about the work we do. We walk different walks of life. We come from different backgrounds, but we're about helping people and helping people to actually grow and find focus and direction for their lives.
Wow, amazing. Just a quick word on juvenile delinquency. You said you worked a little bit with kids who had that. What do you think is the main reason? There's people who say it's single parent homes. There are people who say it's drugs. There are people who say it's, you know, peer pressure. I mean, what in your experience has been the reason for the high rate of juvenile delinquency we're seeing? And that doesn't mean it didn't exist 20, 30, 40 years ago, but I guess it's getting more press. You
Right.
see kids killing other kids, bullying other kids, and,
Right.
kids committing suicide because they feel
Right.
intimidated.
Right.
So what's your take on that? I mean, I guess it happens mostly in public schools,
Yeah.
but I'm sure it happens in private
Oh yeah.
schools too,
Right. Right.
so, but is it a one size fits all? Can we say it's just because of this, or it's multifactorial?
I believe it's multifactorial. One of the two things I do believe is that we don't address a lot is trauma. The trauma, intergenerational trauma, trauma from generations that we're still affecting us today, and also about the impact of that trauma and on our ability to parent and what parenting looks like. Parenting is so different nowadays because of a lot of different factors. We have most families that if there are two parents in the home, they're working. There's not a lot of time being spent with children where you're giving guidance and discipline, and not just I say discipline, but meaning education and correction and just having those conversations about facts of life. And where children are left alone a lot. They are left to social media a lot. They are left to fend for themselves and learn things on their own. Whereas in times that we had elders who passed on knowledge and wisdom from generation to generation, and right now we don't have a lot of that, and some of it is because there are parents out making a living. There's other factors involved where the parent is unavailable or not emotionally available to parent. But I think a lot of things that we haven't just addressed are multifactorial for each individual, that we can't say one shoe fits all.
So that if they don't get it from somewhere, they look for it elsewhere.
100%.
All right.
And I've talked with people who have been a part of a gang, and I remember about 15 years ago I worked with an individual, and he was trying to help me. He was referred for counseling because he was fighting, and he could fight. And I remember going to his high school and talking to some of his teachers, and they was like, all I know, he's good with his hands. He can fight. And he was fighting every week. But we had a conversation, and he said, I have to fight in order to survive. And I have to fight to prove that I'm not scared, because when you're living in my neighborhood, then it means that either I'm going to fight and defend myself, or I'm going to constantly be jumped. And we talked about where his anger stemmed from, and he began to talk about when his dad left and different things that was going on in his family and with his mom. And so when we start addressing those things, the core of his issues, then the fighting resolved. He stopped fighting and he went on to graduate. I saw him in the mall several years later, and he tapped me on the shoulder, and I had no clue who he was.
Oh, wow.
And he was like, "It's me." And he had moved to Texas. He had developed this relationship with his dad. And I was thinking, like, wow. He was like, he just wanted to give me a hug. He was like, I was like, "Are you doing good?" He was like, "Yes, I'm doing good." He was going to attend junior college.
So that
It
brings
was
up another
exciting.
issue. Are there risks to being a social worker? Can you be mugged? Can you be stalked? Can you be sued? I mean, let's put all the eggs on the table.
Yes.
As a doctor, I know what risks are there. As a social worker, am I liable for a lawsuit or mugging or stalking or a patient trying to harass me? I mean, what are the risks in social work? I know it's a great profession. Are there risks as well?
There are risks, and we try to mitigate those risks by making sure we maintain our professional boundaries and ethics. And I think if we always keep those in the forefront of how we practice, then we can sort of steer away from some of those things. Yes, I've done home and community-based services. So when you go into someone's home, you're not in control of that environment. They are, so you don't know who's going to come in and out, or you may be safe in that particular house, but you don't know the outside of the house. And so you have to be aware of your surroundings. Also, it's important to be respectful of those surroundings. I've been in some very tough neighborhoods, some neighborhoods that, you receive police escorts. And I remember driving in one time, and a guy standing outside said, "She's not there." I didn't question him. I got in my car and left. And when I made it back to my office, my client called and said, "You came by?" And I was like, "Yeah, how did you know? I didn't leave a note. I didn't." She said, "My neighbor told me." So there are people in the neighborhood who watch you, and they want to see what you're about. And if you're there, so I think sometimes we just need to be respectful of the places that we enter, that this is their domain, and that I'm respecting you. If you don't want me here, I'm leaving. I'm not here I don't have anything to prove that this is your house and this is your territory. And so even if the client wants the services, we try to find out alternate places to meet. And they say that if we want you to be safe, and we want our services, the people who are providing services, to be safe as well.
So Miss Felicia has given us a lowdown on social work. We're going to continue next week on her spiritual journey and her inspirations in life. You don't want to miss it. Look forward to seeing you with us next week. Jesus is Lord. God bless you.